It's a model which has failed, and the Oxford Policy Management Group report of the last two occasions clearly brings it up. We must find out an answer, and we must mainstream the answer. And I know, sir, without the community, without microcredit, and without political will, and without a desire of the elite like you and me to share knowledge and wealth and power with the poor, not just crumbs to the poor, but power through institutions and organizations, unless that is done, we would not have reached where we have reached. So ultimately, your book correctly points out that equity is the hamlet of the piece, that at the end of the day, just to quote one example, you say that the entire existing coverage of social insurance, which includes the army, which includes safety nets and everything, comes to 41.7 million people, or 20% of the population of this country. And you say that 73% of the population remains uncovered. You say that 57% of the health financing is out-of-pocket expenditure. And you say that the per capita expenditure on health for over 135 million people comes to rupees 374, whereas 26% of the total revenue collection is allocated for 13.7% people. This dimension is very important, the equity dimension. We'll have to address it. This book brings it out. And I end by saying that the other day I was listening to this Azizi program, like most of you, and a very high and mighty personage of this land landed in that program. And Mr. Azizi asked him towards the end of the program, Sir, have you ever been to hospitals, the government hospitals? Sir, the poor people have death in one hand and chicks in the other, and they are roaming around, and there are no medicines, and they have to go here and there. Sir, what is your answer to the problem? And you know what he said? This is on, I won't mention the post. We have great respect for the post. I think if we have not been able to spread awareness, we are to blame. Why is there not political awareness? You know what was the answer? I heard the answer. The answer was, yes, I understand there are these problems. Government can't do it alone. I will be requesting the private sector to come forth and help the poor. And I said to myself that there was a gentleman, Hammurabi, 1,800 years before Christ. He was a king of Mesopotamia, which is considered to be barbaric land today. And he wrote on a rock that the sun will never continue to shine upon a kingdom which does not care for the poor. And I request you to look at the words of Solon, S-O-L-O-N, the Greek lawgiver, jurist, who said that civitas, the civic world, has two kinds of phenomena. One is eunomia. Eunomia means good order, peace, tranquility, justice. And dysnomia. Dysnomia means disorder, violence. And he says if there is dysnomia in the land, everyone who lives in the land is guilty of it. And if you want to bring about eunomia in the land, then everybody will have to play its part. Dr. Sanya Nishtar, you have played your part. And I hope that through your book, the politicians, the professionals, and most of all, the citizens of Pakistan will be better informed. I thank you, sir.
Our next speaker is Dr. Islamabad Hussain, former Governor, State Bank of Pakistan. He also remains for 2 years the chair of the National Commission for Government Reforms. Sir.
Bismillahirrahmanirrahim, Mr. Qadri, Dr. Bilay, Mr. Ijaz Rahim, Dr. Sanya Nishtar, Mrs. Amina Sayyed. It's a very difficult act to follow Ijaz Rahim. I knew him as a poet par excellence, but today I discovered that he's an orator par excellence also. And therefore I would be very diffident in whatever few observations I'm making, because he has captured most of the essential parts of Sanya's thesis, which he has expounded in this book. I'm very grateful to Oxford University Press for initiating this literature on Pakistan studies in various dimensions. And I'm particularly glad that the focus is now shifting from the macroeconomic to the sectoral analysis. And this book by Sania Nishtar is a manifestation of this change or the shift of the sectoral understanding and sectoral analysis, because we are too much a big picture persons and we do not take the pains in order to go in depth and look at the micro and the foundations of the various human endeavors. And to this extent, I am extremely grateful to Sania Nishtar for one of the outstanding pieces of work she has produced in form of this book. I'm her student because as the chairman of the National Commission for Government Reforms, when we were struggling with the reforms of the healthcare delivery, she played a very important role in educating me and my colleagues. And a lot of recommendations of the Commission, which have come out in the form of the report, actually owe our intellectual gratitude to Sania, and this is reflected in her book also. So as a student, I may not be doing full justice because I'm not a health economist, and I'm looking at this from a very different perspective. Her basic argument is that the approach in Pakistan and in other developing countries should move from disease control to a system-wide approach. And that resonates with me for the simple reason that as an economist, most of the determinants of the health status are outside the health care delivery itself. Most of the diseases or morbidity originate not because of the lack of health care delivery, but because we have water, sanitation, environment, nutrition, and other factors which lead towards ill health. And ill health has a very perverse effect on economic growth via its link with productivity. And also, it has a very strong influence on poverty. You tell me that a family which has only one breadwinner has the head of the family indisposed for an extended period of time, and I can predict to you that that family has gone from a middle class status to a status below the poverty line. There is a powerful correlation across cultures and across systems where health status is determining the outcome as far as poverty is concerned. Therefore, the health system reform is extremely important, but it has to be contextualized in the political economy and the governance structure and the fiscal space. And this interface between the governance of the land, the political economy, and the fiscal space determine the efficiency and the efficacy of the health system. In isolation of these three factors, a very beautifully designed health system is just not going to deliver the goods. Therefore, the influence of the health ministry, as people would imagine, is very limited. The basic proposition is that the public policy interventions should be broad-based rather than just focusing on one particular delivery system. Although the internal system should be robust, but the outer system should be supportive of that internal system. Therefore, Sania's proposition that the objective of a good healthcare system should be access, equity, and quality is right on the dot. But there are trade-offs between these three objectives. They are not going to be achieved at the same time, because if you expand the access, there is going to be some adverse effect on quality. And if you are looking at quality, then you might not be able to approach the equitable distribution of health services. Combining all these three objectives in a linear manner is very important. But then the question arises, what is the priority for the public policy? As Ijaz Rahim rightly pointed out, in this country, we have a small elite which has hijacked the state for its own narrow parochial interest. And the same elite has rigged the markets for its own purposes. So we have the worst of both the worlds. The markets allocate resources efficiently, but in this country, the resource allocation or efficiency is down the drain. And the state, which compensates the imperfections of the market by providing equitable solutions, is also, because it's captured by the elites, is anti-equity and anti-poor. So you are in worst of both the situations. So the intervention of the public policy, therefore, for the health system, where 74% of the people are not covered by any institutionalized coverage, falls on the shoulders of the government of the day. And the reason is that even a capitalistic society like the United States, where 42 million people were without insurance, that's only 14% people living below $30,000, which is the poverty line, have now been incorporated in a new health care reform system where they would have insurance and the state would be subsidizing those who are below the poverty line. So even if you believe in a capitalist model, you have to take care of education, health, nutrition, water supply, sanitation as a basic public goods, and they should be tilted and the distribution should be skewed in favor of the poor. And that's exactly what any society which is conscious of the social cohesion and economic welfare would always try to do. And Sania Nishtar makes this argument through her reform package. Because you have the low public revenues, 9 paisas out of every rupee is given to the state, which is supposed to take care of defense, debt servicing, infrastructure, education, health, and you name it. And you expect the government to deliver miracles, while 95% goes into our pockets. This is the starting point, which I had the occasion to observe, is the attitudinal problems of our so-called intelligentsia and the professionals. I'm witness to examples where an officer of any grade is treated with great respect. All doctors rush to his service. All medicines are provided to him. And a person who is poor, who has come, spending all his money, coming from 250 kilometers with his ailing child, is not denied entry to the emergency room unless he pays the attendant of the emergency room some money so he can get access to that emergency room.